Hey everyone, and welcome to today's Explainer. We're going to be unpacking something that is just, well, it's honestly one of the most fascinating and, frankly, unbelievable phenomenon in all of modern medicine. We're talking about cancer just seemingly disappearing on its own, literally without any standard treatment. Now, I know it sounds like pure magic, but as you'll see today, it's incredibly real. I am absolutely thrilled to walk you through this medical mystery, so let's just dive right in, shall we?
So, here is the profound question we're tackling today. Can cancer actually just vanish? It's the kind of premise that sounds like an absolute miracle, right? But what we're looking at today is grounded entirely in cold, hard, documented science and medical reports from all over the world. We aren't dealing with myths here, folks. We're talking about real human biology that we are honestly just beginning to understand.
Okay, to start off, let's get our terminology straight. In the medical world, doctors call this phenomenon spontaneous regression or spontaneous remission. Basically, this happens when a cancer shrinks or completely disappears without the patient receiving any standard treatment. Or, sometimes it happens during a period when the effects of past treatments have entirely worn off. So, the absolutely crucial takeaway here is that standard medicine is not what's currently fighting the disease in these moments.
Now, you might be wondering, how often does this actually happen? Well, there isn't a massive global statistic because, as you'd guess, it's super rare. But the data does show a really striking number, 0.4%. You see, in past clinical trials for a specific type of liver cancer, researchers looked at the placebo groups, meaning the patients who were totally untreated, and they found that 0.4% of those untreated patients experienced this spontaneous regression. So yes, it's way less than 1%, but it's measurable, it's highly documented, and honestly, it's kind of more common than you might initially think for something that feels so miraculous.
Doctors have actually noticed that this phenomenon doesn't just happen out of thin air. There's almost always a triggering event. Which brings us to trigger number 1, acute inflammation.
So acute inflammation, which is often accompanied by really high fevers from an illness or an injury, is a massive trigger. Let's walk through how this plays out in real life. There's this documented case of a 59-year-old woman who originally had surgery for pancreatic cancer. Unfortunately, a while after that surgery, doctors found the cancer had spread. It had metastasized to lymph nodes all over her body. But guys, here's where it gets crazy. Due to some after effects from her first surgery, she started suffering from repeated bouts of acute pancreatitis, basically severe, painful inflammation of her pancreas. Because she was constantly in the hospital fighting this severe inflammation, she literally couldn't receive any standard cancer therapy. But guess what? Despite having 0 cancer treatments, over the course of an entire year, the metastatic cancer in her armpit lymph nodes just kept shrinking and shrinking. Unbelievable, right?
That leads us to trigger number 2, tumor biopsies.
Consider this surgical case report involving a 78-year-old man who had a shadow on his lung. Right before his biopsy, the tumor measured about 1.2 centimeters. Doctors went in, did a standard CT-guided biopsy, and diagnosed him with small cell lung carcinoma. But when they took another CT scan the very next month, the tumor had shrunk by half, down to just 0.6 centimeters. And wait, it actually gets better. By the time they finally went in for surgery to remove that part of the lung, microscopic exams showed the tumor was down to a tiny 0.05 centimeters. It had almost completely vanished, essentially just from being poked for a medical test.
So why in the world does a simple diagnostic test destroy the cancer? Well, the underlying biological mechanism here comes down to localized physical trauma. When a doctor does a biopsy, they're essentially tearing a tiny piece of tissue. That physical damage acts like a giant blaring alarm bell in the body. It draws a whole bunch of white blood cells and inflammatory cells rushing to that specific localized spot to heal the wound. And kind of like a happy accident, while they're hanging out there to fix the tear, they seem to turn around and go right after the cancer.
All right, moving on to trigger number 3, viral infections.
We've talked about localized trauma, but what happens when the entire body is fighting off an invader? Well, recently, the global pandemic acted as this massive, totally unexpected catalyst for studying systemic infections. Just last year, the Journal of Translational Medicine published a fascinating report that gathered 16 different cases where patients contracted COVID-19 and then subsequently saw their cancers regress. And we aren't just talking about one type of cancer. This included blood cancers like leukemia, but significantly, it also included solid tumors like kidney and colon cancers.
And the medical literature doesn't even stop there. There is this wild, seemingly disconnected list of other miscellaneous triggers documented around the world. We're talking things like blood transfusions, or even treating the primary tumor, meaning a doctor uses radiation on the original tumor and suddenly a secondary tumor on the complete opposite side of the body just disappears. Crazy, right? Even taking general medications, over-the-counter herbs, or supplements has been linked to this regression. Then you have tumor hypoxia, which is basically when the tumor grows so insanely fast it starves itself of oxygen, and angiogenesis inhibition, where the blood vessels feeding the tumor just flat out stop forming.
All of which leads us to the ultimate puzzle of this explainer. What exactly connects all of these? I mean, seriously, what connects acute severe inflammation, a tiny needle prick from a routine biopsy, fighting off a respiratory virus, and taking an herbal supplement?
The answer is our main culprit, the immune system connection. Here is the grand unifying thread. Researchers believe all of these random triggers actually fire up a massive immune activation cascade inside the body. Whether it's a virus or a tiny tear from a biopsy, the trigger violently wakes up your innate immunity, specifically your natural killer cells. Then it activates your adaptive immunity. Your B cells start pumping out antibodies, and your T cells are deployed to directly attack the invader. But in this incredibly heightened red alert state of alarm, these immune cells don't just fight the virus or heal the biopsy wound. Nope, they actually recognize the surrounding cancer cells as a hostile enemy and aggressively attack the tumor. They're essentially doing the exact job that chemotherapy or radiation is meant to do, but entirely naturally.
So let's talk about what this means for the future of treatment.
Look, this isn't just about marveling at a handful of medical miracles. By objectively accumulating and rigorously studying these rare cases, doctors are hoping to achieve two massive, game-changing goals. First off, they might be able to identify specific patients who can safely be observed without immediately rushing into harsh, debilitating treatments. And second, and perhaps the most exciting part, decoding exactly how a biopsy or a virus wakes up the immune system to kill cancer could lead to the development of entirely novel immune-based therapies.
Just think about it. From miracles to medicine, studying spontaneous regression could unlock new cancer treatments. What if the key to saving millions of lives isn't some brand new chemical we invent in a lab, but a hidden mechanism already resting right inside of us, simply waiting to be decoded? It's a lot to think about. Thank you so much for joining me on The Explainer today, and remember to keep questioning the incredible science all around us. See you next time.